Welcome to the live internet broadcast of Inner Health, Outer Beauty, where we will shatter myths about health and discuss the latest and greatest non-surgical procedures. I'm your host, Dr. Wanda Dyson, founder and director of Change for Life Wellness and Aesthetics, located on Capitol Hill in Washington, D.C. I am an author of How to Be Healthy, It's Not What You Think. I am a non-conventionally practicing physician who was a conventionally trained MD. And I've also performed non-surgical cosmetic procedures for the last 18 years. Today's guest is Dr. Leslie Ray Matthews, who is double board certified in general surgery and surgical critical care. He is one of the top vitamin D researchers in the world. Today, we will discuss uncommon and common uses of vitamin D. It is my privilege to welcome the esteemed Dr. Leslie Ray Matthews to my show. Thank you very much for coming.
Thank you, Dr. Dyson. Thanks for inviting me.
So we'll just get right to it. As a trauma surgeon at Grady Hospital, you use vitamin D as part of your treatment of brain injuries. Why did you decide to use vitamin D?
Well, first of all, vitamin D is not a true vitamin. It's actually a hormone. So we have 30,000 genes in the human body, and what a hormone does is it controls turning on and turning off genes. So vitamin D controls 3,000 out of those 30,000 genes, or 10% of your DNA. That makes it one of the most important substances in the human body in terms of optimal health care. So one of the things that vitamin D does is it upregulates your immune system, or it increases your immune response, and it downregulates chronic inflammation. So most diseases of aging that we now know are due to chronic inflammation. So you can slow that process or kind of arrest it in slowing down disease processes.
So how did you apply this to brain injuries? You realized there's inflammation involved, so you added the vitamin D to decrease the inflammation from the injuries?
Yes, Dr. Dyson. Actually, one of the things that happens in traumatic brain injuries is that the brain swells and it creates a lot of chronic inflammation in the brain. So it's this chronic inflammation that begins to damage your blood vessels or the tiny blood capillaries in the brain, and it pokes like little holes. It's like throwing darts at a dartboard. It puts holes in the tiny blood vessels in your brain, and then these proteins begin to leak out these tiny vessels and cause all these disarray among your neurons and fibers and stuff like that. Or the tau protein that we now know that's seen in Alzheimer's disease begins to seep out of these blood vessels. So actually what it does is it arrests the swelling and this inflammation process and slows it down and allow these neurons to heal versus progressing to death.
Right. So you can prevent like permanent brain damage by using the vitamin D.
Yes, you can. Yes, you can.
Great. So what type of brain injuries did you commonly see at Grady? I know you saw probably gunshot wounds to the head, but
Yes.
What else might you have seen?
Well, as one of the busiest level 1 trauma centers in the country, we were seeing over 6,000 trauma patients a year. So we were seeing head injuries from concussions all the way up to being shot in the brain or hitting the head, skull being cracked, serious intracranial bleeding or hemorrhage. So we took all comers. We didn't turn anybody down. Penetrating injuries to the head, we saw it all.
Wow. I know that was exciting.
Oh, yes, it was.
What difference in the outcome did you notice in your patients after using vitamin D as opposed to other treatments? I know we commonly would use probably IV steroids for brain injury. So when you added D, was there a difference?
Yes, it was. Actually, we lowered our mortality rate for traumatic brain injuries from 11.5% down to 6.6%. That's almost a 50% reduction in the mortality rate in traumatic brain injuries. And also patients that were mostly in comas for months and months were waking up in a week or less. And
Wow.
So these people had a GCS Glasgow coma score. They were getting scores of 10 and 11 before they even left the hospital. So
explain to lay people what a Glasgow coma score is. What does that mean?
That is a way we measure how somebody's doing neurologically when they arrive in the emergency room. We look at your motor functions, your verbal, and then your movement and eye opening. So if you can open your eyes spontaneously, that's the highest. You get a 4. And if you can move on command movement, that's a 6. So the highest number you can get is 15. So our patients were getting back to, they were coming from Glasgow Coma scores of 3, which means you have no movement, no eye movement, and no verbal. And they were coming up to Glasgow Coma scores of 11, 12 before they left the hospital.
That's impressive. I looked at one of your previous interviews and I saw a patient who was talking about your treatment. She had been given vitamin D and I think progesterone and probably fish oil as well.
Correct.
And you said this patient was driving like 70 miles per hour and her car rolled over several times and she was ejected from her car. What was her recovery like?
This young lady named Lacey was a 17-year-old cheerleader. She just won the head cheerleader at her school, so she was excited driving home, hit a pothole, and her SUV rolled over 8 times. She had her seatbelt on, but the force was so great, she was ejected out the car onto the interstate in Atlanta, Georgia, hitting her head on the pavement. She immediately went into seizures, and she was airlifted to Grady. Seizures is a bad ominous sign in a traumatic brain injury person. It means that they're not doing so well. So Lacey arrived in the emergency room, and we got a scan of her head that showed she had diffuse axonal injury. That's one of the worst types of brain injuries you can have. 50% of patients with diffuse axonal injuries die at the scene. Another 47% are in permanent vegetative comas. And then 3%, the best they get is to looking like a cerebral palsy patient. So these patients do not return to normal because they just have swelling in their brain. The swelling is so fast and so rapid. Most of them die or succumb in the emergency room. They don't even make it, to ICU. So Lacey, we started on the vitamin D. The neurosurgeons came down and basically told the mom there was no hope. Just call the priest. And so I begged them to drill a hole in the head. I said, I'll take it from there. And so the mom said, he seems to be really confident about his abilities or what he can do. So in 3 days, Lacey was opening her eyes. In 1 week, she was like following commands. And then she was in the hospital for 2 weeks. And then she went to extensive rehab. Since that time, Lacey has graduated from college, University of Georgia, summa cum laude with a degree. And she graduated with 200 degrees. She just recently got married and she's living a normal life, and she's a counselor at a school right now.
You are a miracle worker. Where did you get this idea? I'm going to start doing this for these patients. Where did that come from?
Well, actually, when I was in residency, there was nothing you could do for these patients. They used to call it basically growing a garden because all these patients were in comas and they all went to long-term care facilities, and some of them never woke up. Remember Terry Schiavo, the lady that was in a coma for 20-some years and eventually succumbed? So that's the way these severe traumatic brain injury patients, that was a normal course. So actually using vitamin D, we were able to alter that course and get most of these patients back.
Great. I understand, I think from talking to you earlier, that vitamin D may also improve dementia. Is that true? And how does that help?
Yes, remember I said that vitamin D is a hormone. So hormones are different from vitamins. Vitamins are just a spark plug, make a reaction go at a lower temperature. For example, when you eat food, your body temperature doesn't go up to 150 degrees. It stays at 98.6. So a hormone works in your blood system. So you have receptors for vitamin D in every cell and every tissue in your body. You have vitamin D receptors on your brain, your breast, your colon, your heart, your lungs, your kidneys, everything. So it basically affects every organ in your body. And the way it does is dementia is like chronic inflammation also. Remember I said most diseases of aging are due to chronic inflammation, whether it's arthritis, heart attack, strokes, kidney failure. All of this is due to chronic inflammation. And this can be measured by a protein in your body called C-reactive protein, which is a measure of inflammation. And you notice that all these patients, normal C-reactive protein is less than 1. And these patients with strokes, heart attacks get C-reactive protein levels sometimes as high as 15, 16. I've seen as high as 25. And so it works in any disease where you have chronic inflammation.
So explain to lay people, because we're speaking in doctor speak.
Sure. Okay.
So explain to lay people what chronic inflammation is. I look at it like a flame from a flash, or from a match. It's like that's like chronic low grade.
Mm-hmm.
But then it can become widespread in some diseases. How would you explain inflammation to the public?
I explain it to them about when you get a cold that you get that phlegm in your chest and then you cough up this mucousy type stuff. And so that's chronic inflammation is in the lungs. And your nose start running and you got all this stuff coming out of your nose. That's an example of chronic inflammation. And that's what happens with these people with coronavirus. They get this chronic inflammation in their lungs, and then it causes multi-system organ failure, cause your other organs to start failing, like your heart, your kidneys, your liver. And so you basically, it's a spiral downward, basically what it is.
So like in COVID, it's like going from a match to like a wildfire.
Yes, it's a wildfire in your body,
like
basically.
Inflammation on steroids.
Yes, it's a wildfire out of control.
Yes. So there also we talked, I think, about CTE, which is a shortcut for chronic traumatic encephalopathy.
Yes.
And what that is a disease that we see it in like football players, for example, from repeated head trauma.
Yes.
And I was reading that in a journal in 2017 that 99% of NFL players had CTE, 91% of college football players have it, and 21% of high school football players have it.
Yes.
You mentioned that you had a product, a patented, innovative, cutting-edge product.
Yes.
That would be helpful in CTE, chronic traumatic encephalopathy.
Yes.
Have you used it, and can you speak on what it is?
Well, we developed a patent, and what it entails is we use vitamin D, a thing called heat shock protein, which is very important and science doesn't know a lot about. Heat shock protein is basically a protein in your body. It's called a chaperone protein. Or what it does is like anytime your body's under stress, proteins in your body are there for function only. You can store carbohydrates, you can store fats, but you can't store protein. So every protein in your body has a function. So what happens when your body gets hypoglycemic, hyperglycemic, hypothermia, hyperthermia, heart attacks, strokes, and anything, it denatures or alters the 3D shape of these proteins in your body. And they don't work as well when the shape is altered. So what this heat shock protein does is kind of like an envelope. It envelops these normal working reactant proteins in your body, and it keeps them in a normal 3D shape so they can function. It's kind of like an athlete when they first started football training in the summer. They can't run, they're hot, and then 6 weeks later, they're conditioned because their body produces more heat shock protein. So heat shock protein is very important in maintaining homeostasis in the body. Very important. Then we also
describe that word, homeostasis.
Homeostasis means staying at a normal, steady state, or your normal state that you're at. You know, keeping the thing in the same shape it is and doing the same function that it normally does without any difference in it. And another thing we use was glutathione, which is the master antioxidant of the body. And so what this does is this binds antioxidants and keep them from causing damage. Think of antioxidants like leaving your car outside. If you don't wax it, it begins to rust. So it's the antioxidant, the oxidation that causes the rusting of your car. So we combine
an apple when we open it and it turns brown.
It turns brown. So these three products, the vitamin D, heat shock protein, and glutathione, basically inhibits most of all these processes. And so we thought of all different ways that it could work. So it actually works very well. It actually was awarded a patent in December 10th, 2019. And normally it takes about 2 years to get a patent. I was awarded my patent in 18 months. Awesome. And the U.S. Patent Office said this was a novel and unique approach in terms of treating traumatic brain injury, CTE. Remember, in chronic traumatic encephalopathy, you have the word chronic, like chronic inflammation. So that's all CTE is these subconcussive hits. Most of these kids start playing football at 6 years old, And by the time they're 18, they have 21%, like you said, have CTE. So the longer they play, the more hits they get to the head, the worse they get. They progress usually about to stage 4 CTE by the time they make it to the pros.
So what is stage 4? What does stage 4 CTE look like? Can
Stage
you can you treat people with stage 4? Can you take them to a stage 1? Can you reverse this process?
You're not going to totally reverse it, but you can slow the decline once they get to stage 4. Stage 4 is like the chronic stage where you see all types of symptoms in the patients. They're homicidal, suicidal, they're destructive, they have insomnia. So you can slow the progression of it, but you can't totally reverse it.
And there have been some football players who have made the news who either committed suicide
Yes.
or like killed other people or their family members.
Yes.
That's how it makes the news. So could you potentially help someone like that?
Yes, you can and stuff, and so it'll stop the episodes. Actually, I've dealt with some professional football players, and they were sleeping better, less insomnia, less moody, and they said they just felt better, more energy overall. So you can, like I said, stop the progression of it, but you can't totally reverse it. So some of the damage is done, but some of it can be reversed because basically vitamin D is an antioxidant and it slows progression of things down. And so it's very important in chronic illnesses.
So when is this miracle going to happen? When are you going to bring this to market?
Well, actually, I'm in the process of trying to find some investors and stuff because bringing some product to market is very expensive, millions of dollars in terms of producing, manufacturing, and distribution and marketing and advertising. So I'm in the process of trying to find investors.
So hopefully someone listening to this broadcast will be interested in doing so. Let's shift gears a little bit and talk about the hormone vitamin D deficiency.
Mm-hmm.
How common is it?
Well, actually, 97% of African Americans are vitamin D deficient. 97, so only 3% of African Americans have a normal vitamin D level. And worldwide, half of the world's population, there are 8 billion people on the planet, so 4 billion of these people are vitamin D deficient. That's why the coronavirus was able to pass around the world in a whirlwind, because half the world's population is vitamin D deficient. And you cannot have a strong, optimal immune system if you're vitamin D deficient. So vitamin D is like the key in the ignition to crank up your immune system.
So meaning they might have already had some low-grade inflammation going on because they lack D. And then when they met with the coronavirus, that just started the wildfire.
Yes, it goes back to your analogy with the lighter. It's like you already got a little fire smoldering, and then you add in coronavirus, it just becomes an uncontrollable wildfire.
Because they already have diseases that are associated with chronic inflammation, such as diabetes, high blood pressure, obesity, etc. So the stage was already set.
Yes.
And then they just needed the match to set the wildfire.
Correct.
Why is it more common in African Americans?
That's a good question.
And other people of color? I understand it's more common in Hispanic people as well.
Yes.
Why is that the case?
Well, Hispanics have levels just like African Americans. We have more vitamin D deficiency because we have melanin in our skin. And melanin is good for being on the equator when we were in Africa, because melanin protects you from sunburn, skin cancers. However, as you move to more northern temperate climates that we live in now, it works against you. So a Hispanic American or Indian American or an African American has to stay in the sun 3 to 10 times longer than the average Caucasian American to produce the same amount of vitamin D.
So what would that equate to in terms of hours in the sun?
It doesn't equate to hours in the sun. Is that we have to stay in the sun longer. Well, most people work indoors now. Remember, 50 years ago, we were in a agricultural society where people worked outdoors, hunted, fished, kids played outdoors all day. Now we're in a technological society, so hardly anybody works outdoors. And then we have sunscreen, which we didn't have 50 years ago. Sunscreen blocks 97% of vitamin D productions. Then in the Arab populations, they wear hijabs and stuff, and so only things exposed is their eyes. So you go to Dubai, where it's a very wealthy country, they have one of the worst vitamin D deficiency rates in the world. And everybody there has health insurance. So it's not related to health insurance, it's related to not getting adequate sun exposure or supplementing with vitamin D.
So, what should we do about it? Because I think a lot of people are afraid of getting skin cancer.
Yes.
So, they're applying sunblock and
Hmm.
they're avoiding the sun.
Yes.
So, what can be done to bring up those vitamin D levels?
Well, the first thing that can be done is we made a compromise with the dermatologist. Dermatologists don't want you in the sun ever. So the compromise we made with the dermatologist was go outside for 15 minutes and then apply your sunscreen. So you can make that vitamin D. You can make up to 20,000 IUs of vitamin D in a day, and then apply the sunscreen after 15 minutes. The next thing you can do is take supplements like I do. And so, like, I worked 80 to 100 hours a week for 32 years. So I was never outside. So I had to get all my vitamin D by supplementation. You have sprays, pills, capsules, soft gels, liquid. And so there are multiple different, ways or methods you can take it. Sublingual also. So I would recommend, taking one of those methods of taking vitamin D.
So, how much vitamin D should a person take? Is it a cookie cutter thing? Do we all need the same amount? Should we follow the RDA, or how should we decide the amount of vitamin D that we need?
Well, the vitamin D that an individual needs vary based on that person's age, race, color, obesity. Obese patients, they store vitamin D in their fat cells. It's not in the bloodstream. So obese person would need more than a smaller person. A big person would need more than a smaller person. People that have had burns to their body, they can't absorb or make vitamin D. If you have liver or kidney disease, you can't make as much vitamin D because you need healthy skin, healthy liver, and a healthy kidney in order to make vitamin D. So if you have either one of those diseases, you're not going to make as much. Women in the Middle East wear the hijabs and stuff, and so they don't make any vitamin D. Sunscreen blocks 97% of vitamin D. Medications such as steroids, HIV medication decreases the amount of vitamin D your body can make. Being in the hospital, your vitamin D level drops 50% in the first 24 hours, regardless of your disease process, because you're in a dark dungeon, as I call hospitals. So there are about 40 or 50 different things that can affect your vitamin D level or drop it. So each person needs a different amount of vitamin D. So there is no one cookie cutter that fits all. It's based on your concentration of vitamin D in the blood, not the dosage that you take. It's kind of like dopamine. Remember the medication dopamine? At low doses, dopamine affect your renal receptors and it decreases renal blood flow. At mid levels, it affects your dopaminergic receptors and increases your blood pressure. At higher doses, your heart rate. And at higher doses, it affects your heart and increases the heart rate. So it does different things at different concentrations. So same thing with vitamin D. So it's based on that's the confusion that doctors have when they say it don't work. They don't understand if you give everybody 2,000 IUs, everybody's not going to have the same concentration in their blood system when you take a blood sample. So it's based on the concentration. So you have to give whatever you need to give to get a certain concentration. It's not based on the dosage.
You also have to be able to absorb it.
Yes, that's
it
true.
doesn't matter what we take in our mouths. We have to be able to break it down and we have to be able to absorb it. So the gut, the digestive tract also has to be in good shape.
Yes, that's true.
Yeah. It sounds kind of dismal, but I guess if you have a good health practitioner that doesn't look at each person, that looks at you more individually, and rather than cookie cutter method, then we could probably overcome some of this.
Yes, we could.
I personally did some genetic testing, and I think I mentioned this to you, that I have a defect in my vitamin D receptor.
Yes.
So it's kind of like a gatekeeper that helps the D get further into the cell where it needs to work.
Yes.
And as a child, and even as an adult, I broke my bones very easily, and no one ever understood why that was happening. So for someone like me, I might have to use vitamin D in different forms
Yes.
in order for it to work.
Correct.
Correct?
Yes.
Yeah. So we have to look at a whole picture. I've
Yes.
also found that sometimes there is no correlation between the vitamin D levels in the blood
Mm-hmm.
and what the vitamin D level is in the cells. And I do something, being non-conventional, I do something called micronutrient testing, where we
Mm-hmm.
grow the cells in culture and challenge the cells to see which vitamins and minerals are inside the cells.
Mm-hmm.
I had one patient who was 80 years old who was literally gulping huge amounts of vitamin D. Her blood levels of vitamin D were toxic. She had no symptoms whatsoever. When I did the micronutrient test and look at her cells, it was actually deficient.
Mm-hmm.
So there's a lot more to this that we need to discover in order to really help our patients, because it could be someone like me that has vitamin D receptor problems. We don't know what the incidence of that is in the world. And also we don't know what's actually happening on the cellular level.
Yeah.
So we just kind of like scratched the surface of all.
Oh, definitely. Just way more research is needed.
Yes. So you mentioned, well, I think we kind of covered this, that there were 25 conditions that can contribute to vitamin D deficiency. And I think you kind of mentioned that, like cystic fibrosis is one of them, obesity, gut problems. What symptoms might a person have with vitamin D deficiency that we might not recognize as being attributed to vitamin D deficiency?
Well, some of the main deficient is brain fog, inability to concentrate or focus long term, being extremely fatigued, not having any energy, tired all the time, insomnia, not able to sleep at night. Then in women, I've had a lot of ladies tell me their hair begins to fall out, they have brittle nails. People get frequent upper respiratory tract infections like sinuses, bronchitis frequently, and they have colds like year round. Bone pain, muscle pain, and just basically generally not feeling well. Or some
Depression as well, correct?
depression. Yeah, we see a lot of depression too in patients and stuff, and then just not being actually in the ones with mental diseases, their disease is out of more control when they're vitamin D deficient. So once you get them on vitamin D, most of them actually take less medication than they normally do.
So it seems like we need to change our whole way that we look at and treat illnesses.
Correct, correct. Actually, in medical school, they teach you that you just need to eat 3 healthy meals a day, and that's not true because most of the foods that we eat now are deficient in most nutrients, and nutrients can cause diseases, just like night blindness is caused by the deficiency of vitamin A. Scurvy is caused by the deficiency of vitamin C. So it has been the theory of medicine that vitamins can't be used for treatment, and that's not true.
Right, right. So you desire to create a documentary on vitamin D and bring this to the world, this knowledge.
Yes.
What are you seeking in terms of support and bringing this documentary to fruition? And if someone wants to assist you with this, how might they contact you?
Okay, they can contact me. My email address is lematthews MATTHEWS 91 at gmail.com. That's the best way to contact me is through my email address.
Okay. Is there anything else you would like for the listening audience to know about vitamin D that we haven't discussed today?
Oh, vitamin D is very important. You can't have optimal body function if you're vitamin D deficient. And you need vitamin D from the cradle to the grave every living day that you're here on this planet.
All right. So this is very important. And I hope our listening audience gained something from you being my guest today. Thank you very much for joining me. And I'll talk to you again soon.
Thank you, Dr. Dyson. Have a great day.